friend. First of all, I want to convey my greetings on the Doctor's Day. And today I'll talk about a very pertinent topic, that is patient and doctors' challenges in our day-to-day practice, and what are the compliance issues a doctor faces in his day-to-day clinics. I will give some opinion about it. When I started some 23 years back, if I'm not wrong, the doctors in our society were taken as gods, and they used to be very emphatic in their talking to the patient. Empathy was missing. A patient used to look upwards towards the doctor and follow the advice to the T. But now, with the advent of Google and improvement in the sphere of education and awareness, over the years, I have increasingly seen that patients, they maybe because of other sources of information, or maybe just because of lack of awareness, they don't follow the doctor's advice in a way which can help them. So I have seen people coming to me, getting a prescription for diabetes, and then coming back after 4 years with the same prescription and taking the medicines over the counter. And in that way, they actually harm themselves. They deprive themselves from the advancements in diabetes and the new drugs. And a doctor should always make a point to them that 3 months or 2 months treatment renewal or a renewed consultation is a must. Number two, we have seen that if we give a prescription, doctor thinks that this giving a prescription and writing the tablets is enough. But again, in terms of chronic diseases, it is not enough. It is doctor's duty to tell the patient to follow a particular lifestyle, make changes, and tell them to review themselves with recurrent uh, checking the glucose or checking the blood pressure, or doing echo and ECG in respective ailments. Third, I have seen polytherapy. I've seen people increasingly using allopathy drugs with homeopathy and Ayurvedic drugs and getting side effects by this polytherapy. Patient should be told that you can definitely try other pathies and other lifestyle modifications and do whatever you want, but the baseline treatment should never be compromised. And finally, there should be, in my opinion, there should be a sea change in the way doctors in India talk to their patients. We should understand that patient is coming to us to learn, and we should talk to them. Writing a prescription is not enough, especially in a country like us. And we should, as our best knowledge and best possibility, we should educate our patients and take the opportunity to tell them some important salient points about the disease and the compliance. This way, we will get good results. And in our country, in the resources are limited. In take the diabetes, we cannot make a 7 people team as we do in Western countries, and patient actually paying from for their own pocket. They usually don't take services from the dietitian, or sometimes they don't go to get their tests done in the same frequency as written in the guidelines. In that case, it is doctor's duty to educate them and tell them the most pertinent test pertaining to their disease and the frequency they should get it done. And the practice of over-the-counter drugs should be prohibited or should be warned upon, telling them that they should not mix pathies. They should consult their doctors at the right time and don't take major decisions pertaining to treatment and lifestyle modification without the consent of their treating doctor is important. Uh, I hope my colleagues may share my thoughts in this and work upon it. Happy Doctor's Day to everybody once again. Thank you.